Hi, I'm Mark Garrett with National Senior Savings, and today I will be discussing Medicare changes in 2018. Hey, I'm Mark Garrett with National Senior Savings. Just wanted to introduce you to our website, nationalseniorsavings.com. If you stop by there, we have a lot of great information underneath our education tab here. We've got videos, we've got manuals and brochures, and pertinent Medicare links that you can go to. So stop by and take a look at it. We look forward to hearing any feedback from you that you might give us. So starting off, the Medicare changes in 2018 that are coming about. Some we know for sure, some are speculation. Right out of the gate, we do know that Medicare cards are changing this next year. They're going from Medicare cards with your Social Security, very personal information, followed by a letter, to a personal identification number strictly to you. So no longer will companies or agents or anyone else be asking you to see your Medicare card with your Social Security on it. All they'll be doing is asking to see your identification card. It's a great thing. It's been a long time coming in our digital age of 2017, and it's a good thing for people as far as protecting their privacy and identity theft. Medicare Part A. So we don't know the definite changes coming about on Medicare Part A. We do know that more than likely your copays are going to increase some, just like they did in 2017. There's usually a slight increase on your Part A deductible for hospital stays. Then for your hospital stay 61 through 90 days, there'll probably be a slight increase in the copayment you're responsible for, as well as your lifetime reserve days, which go from day 90 and beyond. So look for a slight change in that. I don't know the drastic effect it's going to have at the current time, but do look for that to happen, and we'll keep you updated as we know more information. Medicare Part B. So with your Medicare Part B, a couple of key things. Monthly premiums for your Medicare Part B are currently $134 right now. That means that if you make less than $85,000 as a single individual or $170,000 as a married couple, you will each pay $134 taken out of your Social Security check for your Medicare Part B premium. Then there's the Part B out-of-pocket deductible, which is $183 this year. More than likely it's going to increase too, just like it has trended in the previous 2 years. I think it was $147 in 2015, and I believe it was $166 in 2016. 2017 it went up to $183. Next year I look for it to probably go up around the $200 mark. Now I'll go back to the Medicare Part B premium here that you pay of $134. We don't know what the exact change is going to be, but looking at the Medicare government sites, and I keep up to date reading on those, they are discussing changing the income threshold for your Part B premium. Most people aren't going to see any effect from it. Some people will. Once again, we'll keep you updated as we know more. Your Medicare Part D, great news here. Your Medicare Part D deductible is going from $400 to $405, just a $5 increase. But you say, wait, I don't pay a $400 deductible. And that's true. Some plans have to pay the full deductible with their Part D. Some plans pay a partial deductible. Some plans pay no deductible at all. Most of the time, if you get your medications, like your generics, like your level 1 and level 2 generics, that does not count towards your deductible, and you'll get them at the regular price that you would pay and not have to pay the full cost out of pocket. Some people out there worry about the donut hole, and the donut hole this year is going from $3,700 to $3,750 where it begins. And the out-of-pocket threshold will increase from $4,950 to $5,000. So what does that mean to you? Probably not a lot, because there's not a lot of people that hit that threshold in a year. As a matter of fact, a majority of clients that we talk to here are on generic drugs, very easily managed cost-wise. And then there's a few people that have the very expensive drugs, and they do hit the donut hole. Based on that, it's only going to change by $50 on either side of the donut hole. We'll do a whole nother video on Medicare Part D because it's rather in depth. Medicare Advantage. So what's going on with Medicare Advantage plans? Medicare Advantage plans saw an uptick in enrollment in 2017 of about 2.5%, which that's mainly due to the increase in the population and the amount of baby boomers that are turning 65 every day. There's roughly 11,000 people in this country that turn 65 and become Medicare eligible each and every day. CMS is announced they're looking at changing some of the metrics for the star rating system. So on a Medicare Advantage plan, there's a lot of criteria that go into them getting a star rating. It can be anywhere from 1 star to 5 stars. The more stars, the better, is what CMS is saying that the program is. So based off of that, they're going to look at the star rating system and see if there's any metrics they need to tweak to either bring some companies up higher or hold companies more accountable. It's impossible to address all 2,200 of the Medicare Advantage plans in the United States just because the sheer number, you can't. There's a different Medicare plan for every state, every county, every city. The list goes on, and really we'd have to discuss what's particular to the area that you live in if you had questions about that. When it comes to Medicare supplements, the last thing I want to cover, there's no big changes coming in the supplement world in 2018. There'll be some rate increases, like there always has been. There'll be some rate decreases, like there has been lately. Actually, we've seen decreases in Plan G over the past couple of years, which is great news for you, the consumer. Plan F, 65% of the people in the United States are on Plan F for their Medicare supplement plan. It's still on the chopping block, so effective January 1st, 2020, you'll no longer be able to get Plan F. If you're already in it, you'll stay grandfathered into that plan, but if you're looking to join it, you will not be able to join that plan. The bad thing about Plan F, if you're in it, one of the 65% of Americans, is when that plan goes away, meaning no new healthy people can join that plan, only people who are in that plan will get to stay. You're going to have an aging population that gets older and more health problems along the road. My suggestion to you is if you still got good health at the current time, you need to speak with someone, a broker like myself, and look at Plan G. Plan G has all the benefits that Plan F has, minus that Part B deductible, which is $183 this year. Like I said, it has the lowest premium increases. Sometimes there's decreases. It covers everything but the deductible that Part F covers. And the great thing about Plan G is very affordable to get into from the beginning. It'll keep going past the year 2020. Hey, I thank you for joining me today. If you like this video, please click the thumbs up. If you have any comments, please submit it. Any questions, feel free to ask. We're here for you. We need to know what you want to hear about in our videos in the future. Thanks again.